Welcome back to Conscious Healing, Beyond the Trip, hosted by Dr. Jason Harris. Each week, Dr. Harris explores the world of ketamine and other psychedelics, uncovering how they're helping to treat mental health conditions and chronic pain disorders.
This podcast is intended for educational purposes only. The information shared should not be considered medical advice. Always consult with your physician or a qualified healthcare professional before making any changes to your medication or treatment plan. Please be aware that some of the substances and treatments discussed on this podcast may be illegal in certain jurisdictions. We do not endorse or encourage the use of illicit substances. Welcome to Conscious Healing Beyond the Trip. I'm Dr. Jason Harris. I'm an emergency medicine specialist with a passion for exploring the therapeutic potentials of ketamine and other psychedelics. In this podcast, we dive deep into the medical, psychological, and transformative aspects of these treatments. Whether you're a seasoned practitioner or simply curious about alternative healing methods, join me as we uncover the insights and stories that go beyond the ordinary. Today, we're diving into a topic that comes up in my practice all the time: Spravato versus IV ketamine. What's the difference? How do we know which one might be right for you? All right, these are both two of the most innovative treatments we have right now for treatment-resistant depression. Both are based on ketamine, but they're not the same thing. Today, we'll break down what is Spravato, how it differs from IV ketamine. I'm going to give you the pros and cons of each, and how to choose the right path if you're considering this kind of treatment. What is Spravato? Spravato is the brand name for Esketamine. Esketamine is one enantiomer or mirror image of ketamine. It's administered as an FDA-approved nasal spray for treatment-resistant depression and depression with suicidal ideation. In some cases, it must be used in conjunction with an oral antidepressant. It now has an indication for the use of Spravato as monotherapy only, but not all insurances have updated their policies on this yet, so we're still seeing some pushback when we try to get the prior authorization approved if you're not currently taking something. It must be administered in a certified healthcare setting under supervision of a provider. The patient has to be observed for 2 hours post-treatment. It's not a take-home spray. It's not the spray that you're seeing advertised on social media by these at-home ketamine companies. It's completely different than that. You still have to come to the clinic, but it is less invasive than an IV. All right, let's talk about IV ketamine. It is the traditional racemic ketamine, and it contains both the R and S enantiomers, which are mirror images of each other. It's administered intravenously, so you'll have an IV started over 40 minutes to 4 hours, depending on what we're treating in the clinic. It's got off-label uses for depression, anxiety, PTSD, bipolar, OCD, and then chronic pain, fibromyalgia, migraines, complex regional pain syndrome, restless leg syndrome, and many, many more things. It is not FDA approved for mood disorders or chronic pain. It's only FDA approved for anesthesia in the hospital. It is widely used and studied, and I'm going to talk about why it's not FDA approved because I get this question so many times. It's a generic medication. No drug company is going to spend millions and millions and millions of dollars to do a study on a medication that anybody can produce. So, you have to go through these drug trials and you have to submit all this stuff to the FDA showing how it works and that it works. And nobody's going to spend that money to do that when any other company could come out there and produce the medication generically for very cheap. So that's why it's not FDA approved. It's not that it doesn't work. It's just an old medication that we found a new use for. It is widely used and it is being studied daily. There are numerous papers that come out every week on ketamine therapy. It does have flexible dosing protocols, which can be good or bad. You have some of these cowboy clinics out there that just give the medication willy-nilly. I'm hearing rumors that they're not monitoring patients like they're supposed to, that they're just giving these ungodly doses, and that's just not right. There are flexible protocols, and it's not set in stone just like it is with Spravato. Ketamine is often given in specific clinics or integrative psychiatric practices. The off-label nature means that there's more variability. We just talked about that and how it's administered. Some places do more therapy integration. They do the ketamine-assisted psychotherapy, and then some just infuse and monitor the patient. All right, that brings me to how are they different? They're specifically different because of their chemical composition. Spravato, which is esketamine, is the S enantiomer only. And then IV ketamine is racemic, which is both the S and R enantiomers. All right, there's evidence that shows both of the enantiomers have antidepressant effects, but some argue that ketamine may play a stronger role in long-term benefits of ketamine. Administration: Spravato is administered as a nasal spray. You must be supervised for 2 hours, and there's a fixed dosing schedule. So day 1, you get a 56 milligram dose. Day 2, you're going to get an 84 milligram dose, and then every dose after that is 84 milligrams as long as the patient tolerates it. For the first 4 weeks, you get the treatment twice a week. For the second 4 weeks, you get it once a week. And then after that, it's once or twice a month, depending on how you're feeling. I do have some patients that want to continue it once a week, and we fight with insurance companies all the time to try to make that happen if we can. Some insurance companies are just like, nope, this is the protocol, this is what we're doing, this is what we're paying for. IV ketamine is given as an infusion. Sometimes it can be given as an IM injection. We really try not to do that. It's hard to dose appropriately. You can really make a patient dissociate if you give them too much. If we do go the IM route, because we can't get an IV, we'll give you a half dose, wait 20 minutes and give you the other half of the dose. But the doses can be personalized. At my clinic, I go in and see the patient every single day before their treatment. I ask them how they're doing, how they've been since their last treatment. Did they have any issues after their last treatment, after they left here? And then we discuss whether we need to go up on the dose or stay the same. But again, it's personalized for every single patient. Everybody's different. There is greater variability in protocols. I've talked about this a couple of times before. This can be a good thing or a bad thing, but it does give me as a physician the opportunity to personalize that treatment for my patients. All right, FDA approval, we've already talked about why IV ketamine is not FDA approved and why it will never be FDA approved unless somebody makes a change to it, like providing just the R enantiomer or something like that. Spravato is FDA approved because Janssen and Johnson & Johnson went through all of the drug trials. They went through all of the paperwork, spent hundreds of millions of dollars with to give the FDA what they needed to get it approved. IV ketamine is off-label. It's not FDA approved. And this really just matters because of insurance covers and perception. Some patients feel more comfortable with an FDA-approved option. Others don't care as long as it works. Let's talk about insurance and access. Spravato is often covered by insurance. It does depend on your diagnosis. It's only covered for major depressive disorder with suicidal thoughts and treatment-resistant depression. You have to have failed a certain number of medication trials, and it also depends on who the prescriber is. As an ER-boarded physician, I cannot prescribe Spravato for certain insurances. They want it to be prescribed by a psychiatrist, which we have a workaround for that. We take care of that. We have a psychiatrist we work closely with that reviews and talks to all the patients and writes that order for the patient if it's necessary. And then IV ketamine usually isn't covered. I have one patient who I've heard has gotten a little bit of their money back after they've met their out-of-pocket deductibles for the IV ketamine, but for the most part, it's not covered by insurance. Cost, again, Spravato is covered by insurance. It can be expensive for some people, depending on their insurances. If you've got a high copay plan or a high deductible plan, then, it can be a little pricey, because you have to meet those out-of-pocket deductibles and those out-of-pocket maximums before the insurance company will pick up the full portion of it. Janssen does have 2 assistance programs. This is as of October of 2025. I'm not aware of them taking this away for next year, but it could happen. So, if you're watching this in the future and it's not there anymore, it's because they've done away with it. The patient assistance program is not for anyone with government insurance like Medicare or Medicaid. So if you have traditional Medicare and you don't have a secondary, a lot of times it's cheaper just to do the IV portion. It would put you out of pocket quite a few $100s each treatment. So if you do qualify for the patient assistance program through Janssen, they offer an $8,100 medication assistance. Basically, the patient pays $10, and then anything else the insurance doesn't cover, Janssen will reimburse to the provider up to $8,100. And then there is an $800 observation rebate. If you go in to see your doctor, they give you the or your provider, it could be a nurse practitioner, and they give you the treatment, and you owe X amount for the observation portion of the treatment, then that is paid to the patient as a rebate. You have to pay the clinic first, that portion. They'll help you fill out the paperwork, and then you send the paperwork, and they'll mail you a check back. Just like if you went to Lowe's and bought a washer and dryer, or refrigerator or something, and they offer a rebate, you mail it in, usually to El Paso, Texas, in this case is where it's at also, and you'll get a check back from them up to $800 a year. And it does start over every January, so you can utilize this for multiple years in a row when your insurance deductibles and stuff reset. For IV ketamine, it ranges anywhere between $300 and $1,200 per infusion, depending on what the treatment is being used for. It is going to be completely out of pocket in most cases. Very rarely do insurances cover the cost of it. We can provide a super bill, which allows the patients to send that to the insurance. It'll at least go towards your out-of-pocket deductible, but they may not send you any money back. Let's talk about the onset of effectiveness, how well it works. Both can work within hours to days. There's some mixed data on which works better, mostly because nobody's done a head-to-head, double-blind, randomized control trial to compare the two. And because, how do you do a randomized double-controlled trial on a medication when one's given intranasally, one's given IV, unless you give the patient an IV and you give the patient a nasal spray? Maybe it's a placebo nasal spray and it's an IV, or other way around. But again, nobody, to my knowledge, has done a study like that. So we don't know which one is technically better. I can tell you in the data, about 85% of patients who get IV ketamine have a statistically significant improvement in their symptoms. And then for Spravato, it's 70% of patients have a statistically significant improvement in their symptoms. But what Spravato also has is 50% of patients have a complete resolution of their symptoms. So their depression score goes from something high down to where they don't even have depression anymore. IV ketamine does, sometimes have a faster onset, and again, it has more flexible dosing schedule. As far as side effects, both can cause dissociation, both can cause nausea, both can cause blood pressure spikes. Spravato side effects seem to be a little milder due to a lower systemic dose. When you're giving the nasal spray, it's dependent on the patient, how well they get it into their sinuses and how well, how much of it actually runs down the back of their throat. The studies have shown that you get about 40 to 50% of the medication intranasally, whereas if you do an IV, you get 100% of it into your brain. Because of that, IV ketamine may cause a stronger disassociation, but some patients and clinicians argue that that's part of the therapeutic effect. They think that if they have that dissociative state, then they're going to get better. They're going to get better quicker. They don't feel like if they don't have that, they're not going to get better quicker, which is, in my opinion, not true. It's just all about getting the medication in your body and in your brain. How do you choose between the two? All right, that's what we're going to talk about next. So there's some questions you need to ask yourself Do I have to have insurance to cover it? If the answer is yes, then Spravato is going to be your only feasible option. If the answer is no, or you don't have insurance, then IV is going to be your only feasible option because Spravato is much more expensive per treatment than IV is. Are you open to off-label treatments? If the answer is yes, then IV ketamine is a much more customizable but not FDA-approved treatment. If it's not, then you may want to go to the Spravato if you're not okay with an off-label treatment. What is available near you? Not all clinics offer both. In the beginning, I did not offer Spravato. I only offered IV ketamine. Now that I've been open for longer, I'm offering the Spravato. Been offering it for about 18 months, and I've helped so many people. We've done so many treatments. Are you looking for a therapy integrated experience? Are you wanting that ketamine-assisted psychotherapy? Some clinics do offer that ketamine-assisted psychotherapy, but not all clinics do. It is difficult to find a therapist who's trained in ketamine-assisted psychotherapy, so not all clinics offer that. Do you need a rapid intervention? Are you acutely suicidal? If so, both options can be fast-acting. I think IV is a little bit more fast-acting than the Spravato. But Spravato is approved for acute suicidality in some contexts. All right. Do you have a preference for the route of administration? Some people are 100% against IVs. Others, they're not crazy about having the nasal spray. So it's just going to be what your preference is. Some other considerations. Do you have any comorbid conditions such as untreated hypertension, pregnancy, all kinds of things that you need to discuss with your provider? Do you have anxiety or just, depression? Was your depression causing your anxiety? One of the two. Your provider is going to help you decide. Because Spravato is only indicated for treatment-resistant depression, you're going to see if you've got a lot of other things or you don't have that primary diagnosis, then Spravato is not going to be an option for you. Do you have a history of substance abuse? One of the questions that we have to fill out whenever we're doing a prior authorization for Spravato is, the patient does or does not have a history of substance abuse. Ketamine is a Schedule III medication. It does require lots of work to keep up with every single drop of the medication. So that's something we have to do at the clinic. But also, it can, in high doses over a long period of time, cause a psychologic dependence. I mean, patients feel like, I've got to have it. Well, no, you really don't. You've got that medicine in your system. You're doing fine. You won't have a physical withdrawal, but in high doses over long periods of time, you can see a psychological dependence with it. Do you have the correct support system? You have to have a ride after every treatment. You should have supervision at home after every treatment, and you have to make sure you can come to your follow-up appointments. At the end of the day, this is about matching the right patient with the right treatment, not about which one is better in general. Some final thoughts. We're in an exciting era for an interventional psychiatry where we finally have novel tools for treatment-resistant depression. Spravato and IV both offer hope for patients who haven't responded to traditional medications. You need to talk to your provider, weigh your options, and don't be afraid to ask questions. If you're curious about either option, you can check out our website or our social media sites. I'll drop some links below so you can more easily find all of our social media and our website. All right, stay tuned for next week where our next episode, I'm going to discuss the teacup update. The Texas Compassionate Use Program. 60 days ago, we had major changes, and I'm going to go over what has really changed and what hasn't. This is going to be really upsetting to a lot of people because some of the things that were required to be signed off on by October 1st, here it's October 23rd, and they still haven't been signed off on, specifically the approved inhalation devices. This podcast isn't medical advice. It's a conversation, one that's evolving. So talk to your doctor, ask the hard questions, but remember your provider may not be up to date on the latest research or may just be closed-minded to the use of psychedelics, even though the science is there. Stay skeptical, but stay open-minded, because sometimes the most healing paths are the one we nearly forgot. Thanks for joining me on Conscious Healing Beyond the Trip. I'm Dr. Jason Harris. Until next time, stay curious and stay informed.